I know you said you want to go live on your page, so if you want to twist this party around, welcome.
Hi.
How are you?
I'm doing great. How are you?
I'm doing good. I am just going to mute this jazz here and just greeting everyone as they come in. Beautiful, beautiful, beautiful.
Hi, everybody.
Hello. Thank you so much for tuning in. Thank you. Thank you. Thank you. So I am going to introduce myself and just talk about what I have going on here. And then I will give Dr. Jade. Do you like to go by Dr. Jade or Dr. Norris?
I like to go by Dr. Jade.
Okay, beautiful. So I love that already. Very personable.
Yes.
So hello, everyone. My
Hi,
name
everybody.
is Paris. I am pretty much the organizer for Las Vegas Meetup. So what we are is a promotions company where we promote entrepreneurs, business owners, career-driven professionals, and we host network events. And so that's essentially what we are. We are here in Las Vegas. I'm not lucky enough to be a Las Vegas native. Hello, welcome in. If you can hear me okay, just put a thumbs up in the comments. I'm not lucky enough to be a Las Vegas native, but this is my second home. I'm from Detroit, Michigan, and have been here for about 7 years. January will make 7 years, and I'm super, super excited with what we have going on here. And I just look forward to continuously serving the Las Vegas community. This is my home. Yes.
That's what's up. It's nice to meet you.
It's
I'm
nice
glad
to meet
that,
you too.
I'm from Vegas. I like to say I'm from Vegas, but,
Okay.
I moved here when I was 8. So if I say I'm from Chicago, Chicago people are like, once you move when you're a child, that doesn't count. So I say I'm from Vegas. I grew up here. I love it here. And I'm happy to be back home. I've been gone for 10 years and I'm back here in my hometown. So I'm excited to be able to serve Las Vegas as well.
Yes. And I do want to thank you so much. And thank you for your time. Thank you for taking the time to speak with us and share more about yourself. So I really appreciate that.
It's a pleasure. Thank you for asking me and for having me.
Yes. And then did you want to introduce yourself or do you want to get right into the questions that I have for you?
Sure, I'll introduce myself. Okay. So I'm Dr. Jade. So I am from Vegas, went away. I always wanted to become a physician, always wanted to be a doctor, attended med school in Illinois, attended residency in Southern California at Loma Linda, and I just finished up there over the summer. So I'm fresh back to my hometown, to Vegas. I'm on maternity leave right now. I'm 2 weeks away from having our second girl. And so after that, in February, I'll take a little time off. And then in February, we're opening our private practice called NSPIRE Primary Care here in the Las Vegas community. And I'm so excited to serve my hometown. So I can't believe I'm living my dream career, but able to do it my own way and serve my patients the way they really deserve to be served in this type of practice model, which we'll get into. So super excited.
Super excited. And I really gravitated towards you. One, your fun TikToks. And two, I'm not a doctor, but like in my 3-year-old mind, I was always going to be a neurologist.
Yes.
And, and I'm super excited because I would say that I'm a millennial, and in this growth process, I've found that preventative care is like my favorite kind of care because I've noticed that there's a lot of things, that services that we can get having insurance, but we really just don't know. We really don't take the time out for ourselves. And so I'm an advocate for preventative care because there's so many different things that you can do to really be impactful in your health journey. So I do want to ask you a couple questions that you can help all of us really be impactful. I'm sure like many of you have started New Year's resolutions already, where there's like, I'm not eating dairy, or I'm not eating this. I'm going to be on that treadmill. I completely understand. I'm the same way. The only difference is this time around, I really want to get into what it's like to make those permanent lifestyle changes because I have such a hard time. I can purge, fast, detox, but some way, somehow, like the taste of a McDouble still kind of will linger on my tongue. If it's like been like 2 years, I'm like, where did this come from? I don't even have a taste for this. And so I'm hoping that you could just kind of help us and direct us and give us some insight on how we can really do things. So I do want to ask you a question. Even if we consider ourselves healthy men or women, whether that's our lifestyle, our diet, what is it that we can really do? Any services that we can go and receive to know just how healthy we are and where we are in our health journey?
So that's a great question. So I love everything you just said, because my background is I got additional training in lifestyle and preventive medicine. So that's my passion. My why in medicine is to help prevent and reverse chronic disease, especially in communities of color. And I'm really passionate about the evidence-based ways to do that with lifestyle changes. Okay, so everything you're talking about is like my bag of tricks. Okay, it's what I love. It's what I can go on and on for hours about. And that's why I started my practice, NSPIRE Primary Care, because I'm able to be a wellness-focused physician in a private practice setting, where in a traditional setting, it's more about sick care and about prescribing the pill, and you just don't have the time to talk about the prevention. So that's a great question. So the question is, if you're healthy, or if you think you're healthy, how do you know? And that's a great question, because first of all, everybody can benefit and needs a primary care physician, a family medicine physician. Of course, I'm biased, but in medical school is when I really learned about family medicine and what a family medicine doctor does, right? So we're not just there for, when you have diabetes or when you have high blood pressure and to give you insulin and a pill for those things. But the real benefit is to try to have a physician that knows you, that has a long-lasting relationship with you, and that can help you with personalized prevention, right? Yeah. And so when you ask, how do you know if you're healthy? There's all types of metrics that we can do, right? Personally, with my patients, I have a method that I have created called the Inspired Health Method. Wow. And it looks at different aspects of wellness and basically creates a personalized wellness plan with my patients. And it's something that we periodically check in on and tailor and change to the patient to help transition them to their optimal level of health, or keep them where they're at if they've already reached their goals. And it's looking at your nutrition, it's looking at your stress levels, it's looking at so many different aspects, your sleep, there's so many components that contribute. Now, when you look at a medical, that's the wellness bag, right? Because I'm a wellness physician, but then I'm also a trained medical doctor, right? So the medical side of me is going to also look at the numbers and the analytics and the data. I'm going to be looking at your blood pressure. I'm going to be doing a PHQ-9, or a patient health questionnaire that screens for depression. I'm going to be doing a GAD-7, which looks for your anxiety levels. I'm going to be assessing your sleep, so there's other things, your A1C, which looks at your diabetes, your lipid panel that looks at your heart disease and cholesterol risk. So, you have the numbers, but then you also have the lifestyle aspect, and all of that encompasses your wellness.
I love that. Thank you so much for answering that in detail, and really you touched on two things that I'm going to bring up, and pretty much, how do you assess for or consider mental health conditions that could be impacting the physical well-being of patients?
Absolutely. So the thing about it is, one, the reason I love family medicine is what we call continuity of care, which that just means you have a long-term relationship with the patient. You're not coming into me for the first time. I've never seen you before and I'll never see you again, which is why I love this specialty. Because when you know your patients, you get to know your patient. I know who your family is, your kids. I know if you've lost your job. I know if you have, food insecurities and it's difficult for you to, have access to fresh fruits and vegetables. When I know my patients that way, I can also help assess if something is off because of depression, because of acute stress, because your father just passed. Those are all important, right? And so I think that relationship aspect of having a primary care doctor, not just going to them when you're sick, okay, but having that relationship already established before you're sick, right?
Absolutely.
Really helps that relationship to be able to say, okay, something's off, but let's look at these aspects. Okay, well, let's look at these medical aspects. Is it your thyroid? Is it, these other things that can really throw off your mental health? Or is it something in your personal life? And having that established relationship can really help us delve both into that personal versus that medical aspect.
Yes, I love that. Thank you so much for, excuse me, answering that, because sometimes, so much so, I feel like everyone gets caught up in working, and, we try to block out important things, and we really don't realize how much our mental status or even stress status plays a part on us feeling tired, us not feeling fatigued, us not want to eat. And then if you have issues such as like any high blood pressure, hypertension, anything like that, now your body is, you know, under stress, and you really, really need to be in tune with that. And it's really important, I agree, to have a primary care physician, because you can always, always, always just kind of circle back and say, you know, what is it that, you know, what's going on with me here? I got some signs. I don't really know what's going on. This is what's going on in my life. And you're able to really use those details to assess and how we're going to move forward with our changes. And so working with individuals with conditions such as like diabetes and hypertension, like, do you include any stress relieving tools and lifestyle changes to bring down those numbers when talking to patients about these numbers? Do you also consider stress, anxiety, just environment?
Absolutely. So as far as lifestyle related tools, that's what I'm all about. So that again is personalized to the patient. You know, some patients really have a spiritual foundation and, you know, find prayer, and that aspect is really helpful for them. I pray with my patients where that's helpful. Some patients really enjoy meditation. Some patients really enjoy fitness, hardcore fitness. Some people like hiking. Some people like yoga. And there's evidence in, you know, evidence-based exercise helps to decrease depression and anxiety, right? And so finding a way that's fun to the patient, that they can stick with, and that works with their personal lifestyle and personal beliefs, we explore all of those things. And the reason I love my practice, Inspire Primary Care, which I'll be starting, is because we'll be able to have 30 to 60-minute appointments versus the typical 8-minute appointments.
Okay.
That will allow us to really explore, you know, fitness, nutrition, stress in a way more in depth than I would ever be able to do in a traditional practice. I also love that I'll be able to do walking appointments with my patients. So we don't have to stay in the office. We can do this as a walking appointment. I plan to have fitness events with my members. I plan to have healthy cooking events with my members,
I love that.
yoga events with my members. So I plan to have monthly wellness events and educational events where we can get together outside of just a formal appointment time. And that's something I wouldn't have the freedom to do in a traditional system. So yes, all of those things are super important. I'm super passionate about those things. And this type of practice will allow me to do that.
And I want to talk about the practice. So Inspire Primary Care is the name of the business. And for a lot of you that may be unfamiliar, this is Dr. Jade Norris. Thank you so much for joining us. And so she goes by Dr. Jade, and she has Inspire Primary Care. And her service is unique, and which is why I'm interviewing her. I want to talk about it. It's direct primary care. So what exactly is direct primary care?
Yes, and I see in the comments the most common question I get asked, which is, what insurance do you take, right? And so what direct primary care is, this is a membership model of medicine. You can think of it like a gym membership. You can think of it like a Costco membership. So basically what that is a flat monthly, an affordable flat monthly fee. And for that, you get unlimited primary care services, first of all. And the other thing that I love is that you don't have the barriers that insurance creates between you and your doctor, meaning my patients will all have my cell phone number, okay? They will be able to text me, they will be able to call me, and they'll be able to email me directly. Versus in the traditional system, there are barriers in place because insurance creates those. So to answer your question, I don't bill insurance, meaning if you have no insurance, you can become a member. And if you have insurance, you can become a member. And we encourage you to have insurance because we basically are using insurance correctly, meaning that if you need to go to the hospital, an emergency room, need a surgery for your medications at the pharmacy, that's when you use your insurance. But to see your primary care doctor, to talk about your nutrition, to assess your cancer risk and do your pap smear, to get your lab work done. I mean, on my website, I have all the things we do. But truly, primary care is over 90% of care.
Yes.
About 10% of care is surgery, specialty care, and hospital care. And that's when you should use your insurance. So it's great because patients that have no insurance can be members. Patients that are fully insured can be members and use their insurance appropriately. So I hope that answers the question. That's what trips people up the most, is like, wait, what about your insurance? You don't need it for primary care. We bill it in the traditional system, but I don't need to know what insurance you take to refill your lisinopril and to do all the other things I do as a primary care doctor. So it's really awesome.
I love that. And I want to, and while we're in the middle of this, I want to put your Instagram, Inspire Primary Care Instagram in the comments. And
Okay.
then that way people can go to your page and keep up. Let's take a look here.
Let's see, IG, I'll put it too. I think somebody asked about TikTok and then somebody asked about websites. So I'll try to put all those things.
Nice. I love this, guys. I want to thank you again so much for tuning in and taking the time out, because health is wealth. Health is wealth. And
Yes.
again, I absolutely love primary care. It wasn't until I spoke with a primary care physician that I learned that, I can learn things about my diet. I can learn things about, just so many different things that I was allergic to, any recommendations that they had for me, I was able to follow up on in depth. Okay, perfect. So I just pinned her. Beautiful. Let me put this.
There we go.
Beautiful.
Oh, and so I think somebody asked about the business, the practices Instagram. So I'll just put that too. It's Inspire Primary Care, but I just put it. And we do Inspire without the I. For my last name is Norris, so we just do Inspire with the N. So yeah, there we go. I think we answered all the questions.
I can only pin one comment. Yes. Okay, so let's talk about this. So for example, you said that you don't bill insurance, right? So a lot of people have questions like, okay, well, you're not billing insurance. How does this really work? And then if we have any other medical professionals who may not be versed in the laws and ethics of Nevada, when we talk about paying you directly, I want to ask you, is this within the ethics and laws of insurance in the state of Nevada?
Absolutely. So this actually isn't a new concept. Direct primary care has been done for the last about 20 years. So it's a baby, but 20 years is a long time. So there are over 1,000 direct primary care offices across the 50 states. I will be the 5th direct primary care office in Las Vegas. Okay. So this isn't a new concept. Of course, it's legal. I mean, this is my medical license. I've worked my whole life for this medical license. So of course I wouldn't do anything that didn't abide by the state. You have to get it's basically creating your own business. And this model is absolutely done. So basically, it's like concierge. A lot of people have heard of concierge medicine. It's basically like what the stars have, where they have their doctor's number and the doctor comes to them, right? But it's an affordable version of concierge. Basically, it's concierge for the everyday person who can afford, who doesn't have to pay $2,000 and up per month for their doctor. Okay, so that's basically what this is. We've taken this model that the rich, the top 10% of earners have had, and have created a way to do it where most people can afford it.
I love that.
So yes, definitely legal.
Right.
Of course.
Just in case anyone has any questions and talking to their insurance or their doctor, we touched on it, right?
Yes,
and
yes.
The beautiful thing is that she is located here in Las Vegas. And I want to thank everyone that's tuning in that's not in Las Vegas, but we're definitely going to just ask like a bonus question. If you are not located in Vegas, how you can be impactful in your own healthcare journey. You have open enrollment going on right now, right?
Yeah.
I want to talk about that. What does that look like? How many, you said it, how many patients are you seeing? How long is open enrollment for, and how often does it come around?
Okay, so that's a great question. So yes, our pre-enrollment just opened on December 1st. So it's been open a couple of weeks. And I encourage people to pre-enroll, because basically pre-enrollment is just the period of time before our doors officially open, which is in February. Okay, so we officially open in February. This is our pre-enrollment time period right now. And the benefits to pre-enrolling is, once our doors open, there will be a $99 enrollment fee that helps with your onboarding and me requesting your records and getting your medical history, your very detailed initial physical exam. So that's the first enrollment fee, but that's waived if you enroll during the pre-enrollment season, right? So that's one benefit. Another benefit is that because my patients will have my cell phone number, because they will be having availability to same day or next day appointments, where the typical wait to see a primary care doctor is a month, because we will have 30 to 60-minute appointments, where the typical appointment time with a primary care doctor is 8 minutes. Okay. Right. So because you have these benefits, I have to take a smaller patient panel. Okay. Something that most people don't know is that the average primary care doctor has 3,000 patients per doctor. Okay.
Wow.
So for every primary care doctor, there are 3,000 patients assigned to them, which is why it's so hard for you to get in touch with your doctor when you're out of the appointment, and why it's so hard to book an appointment with your doctor. Okay.
Right.
So because of that, I'm giving all of this extra access because I'm only going to be able to accept a max of 600 patients. So instead of 3,000, I'll have 600 members at our practice. And so that's another reason I encourage people to pre-enroll, because you'll secure your spot. Because once we get to 600 members, we'll have a wait list after that to get into the practice.
That's good to know. Definitely. I'm definitely inspired myself. So amazing that the name is Inspired, because I'm just like, I'm going to say this, and I probably sound so cliche at this point. I'm like, it's nothing better than primary care, because you can really connect and find out, what type of approach do you really want to take and what's reversible. That's that close-knit relationship that's going to direct you to everywhere else you need to go and what you need to know. And so this is our last question, but then I'm going to ask a bonus question for the people who are out of state. Sure. Because you're based in Las Vegas, this is your home. This is our home, and a lot of the viewers' home. What do you want Las Vegas community to really understand about primary care, and why is it so beneficial for us, especially just having access to you?
Yeah, that's a great question. So I would like to approach this question by thinking of it from the patient's perspective and the patient's experience, and then from the doctor's experience. Okay. So from the patient's experience in our traditional healthcare system right now, patients have to wait a long time when they see their doctor. It takes a month to get an appointment on average with your primary care doctor. It's difficult to reach your doctor outside of office hours, okay? A lot of times we have to figure out if your doctor takes the insurance, or if they'll pay even if they do take the insurance. And then there's typically 8 minutes max that your doctor can be in the room. So that's the patient's experience, really impersonal, really rushed, and frustrating, okay? And then you have the doctor's perspective, which a lot of people don't get to hear about this, right? But because I'm starting my own thing, I can talk about, the doctor's perspective. And from the doctor's perspective, patients are booked back to back to back, over 20 patients a day. They're overbooked. A lot of people don't know that doctors actually, their pay can get penalized if they're in the room for longer than the allotted time. Most doctors or businesses can only allow the doctors to be in the room for a max of 15 minutes. And if you stay longer than that, your pay can get docked. So, doctors have that pressure. And most of the time we spend more time on the computer and with paperwork and talking to insurance companies than we do talking to our patients, just based on the way that our system is set up. So it's very, it's very frustrating from the doctor's perspective too. So then when I heard about direct primary care and this membership model where I could eliminate insurance from primary care, use insurance appropriately for emergencies and surgeries and things like that, which is about 10% of care, and then 90% of care, which is primary care, to just literally personalize the care to what my patient needs. If my patient needs a half-hour appointment, we can do it. If my patient needs an hour appointment, we can do it. If my patient wants to walk outside during our visit, no problem. If our patient wants to work out and work on and just talk about nutrition, well, guess what? In the traditional system, we can't bill for that. So we can't do an appointment just for that, and people don't understand that. So to me, this is a beautiful solution to a really serious problem in our system that really brings the quality of care down for our patients. And so I'm empowered and inspired when I can really make a difference in my patients' lives. That's the whole reason I went into medicine. I didn't go into medicine to rush through my patients. And so when I can spend time with them and have the freedom to really see their health transition or transform, I should say, then, that's what brings me joy. And that's what keeps me going. And so I'm super excited about this practice. I think that's what I would want people to know, is that it's both ends are frustrated with our system. Yes. Both the patients and the physicians for different reasons. And thankfully, there is a solution through this membership model. And I'm excited to provide that here in Vegas through Inspire Primary Care.
I'm super excited because it is like, I think of all the questions I have after the doctor leaves. I'm like, I said I was good. I lied.
Exactly.
I had one more thing. And Listen.
Exactly. You always think of what you want to say once you're gone. And once you're gone, it's like, it's over. I have 4 more patients waiting and they've been waiting an hour. They're mad. So no, with this, it's like, oh, I forgot. Let me just shoot her a text. Let me just shoot her an email. No
Yes.
problem.
I love that accessibility. And Nia, you asked, why is that? I know it was early on in her talking about, I think it was somewhere about why doctors have to leave the room, but if you can just elaborate in the comments and we'll come back to it. And Pump and Stash, you asked, does your practice have an OB or affiliated with the OB practice?
Yeah, that's a great question. So yes, Nia, why is that? Let me know which aspect of what I mentioned you were asking about, and I'm happy to answer that. And then for Pump and Stash, no, my practice does not have an OB affiliated. However, I would assist in getting you coordinated with an OB. So if you have insurance, I would help you coordinate which OB that you prefer based on which hospital you want to be at. Some patients have, specifics if they want to see a woman or if they want to see a woman of color or whatever. And I can help coordinate that and call the different offices and let you know, like, oh, these 4 OBs or 5 OBs would be perfect for you based on what you say you want. If you're uninsured, I can find cash-based OBGYNs. I have some friends that have offered me cash-based prices. And basically, that's how it works for most specialties. I have a cash-based list if you're uninsured. And then if you're insured, then we just help coordinate you. Basically, I'm like the quarterback of your healthcare. And I help with the coordination and the navigating the system. So I am actually trained in OB, but I do not practice OB, so I would coordinate that with my patients, okay? And then Nia says, yes. Oh, let me know if that answered your question, Pump and Stash. And then, yes, why do doctors get penalized? Oh, Nia, if you want to know why they get penalized, you gotta go back to the coin, back to the dollar. So they get penalized because the system makes more money with the more patients the doctors see. So if they can squish in 20 patients or more in a day, well, that limits how many patients you can see from 8 to 5. And so it's all about the system getting as much money as they can by the doctor seeing as many patients as fast as they can. So that's why. And so again, when the system focuses back on the patient and not on the insurance companies generating money, then we can actually produce quality care for patients again.
Love that. I love that. And for the viewers that are out of state, right? They don't have access to you, unfortunately. However, what do you recommend in this case? Like, do you even, okay, so a 2-part question. What do you recommend, like, if they are interested in direct primary care, how do they research that locally for them? And then the second part of that question is, having, whether it's direct primary care or just a primary care physician in general, what are some things that they can request of their primary care physician just to know that they're on the right track?
Okay, that's a good question. So first, I am licensed in the state of Nevada, so I can only see patients in the state of Nevada. So if you don't live in Las Vegas, I can't directly be your doctor. However, if you're interested in the wellness aspect, not the medical aspect, the prescribing aspect, but the wellness aspect in working with me, I do wellness consulting. So that can also be booked through my Instagram and through my website as well, is my wellness consulting. I can do that anywhere, but it's not medical advice. It does focus on the lifestyle and prevention that we mentioned earlier, right? And so if you're interested in direct primary care from a physician, but you don't live in Nevada, so you can't see me, then you can simply Google direct primary care in your state. And, it will pull up the direct primary care doctors in your area, or, your city, I guess would be better. Direct primary care, I don't know, Chicago, and it will pop up the doctors that have it. Also, there's a website called DPC. So direct primary care, the acronym is DPC. There's a website called DPC Alliance. And on there's something called a DPC mapper, which is a United States map, and you put in your zip code and it pulls up all the DPC practices in your zip code. So that's another easy way. So, Google is your friend. So.
Right. And then, and the second part of that question is, if they are pretty much, just seeing if they have a primary care physician that they're seeing, or even someone new, what should they ask to really get them on the right track, or just to get a little bit of confirmation on, where they are in their health journey?
So I think the main thing is first establishing care with the doctor that you feel, even if you're in the traditional system and you're like, hey, one, there's not direct primary care in my area, or whatever the reason, I want to use my insurance-based doctor, just establishing care with a doctor that you trust and have a good rapport with, because at the end of the day, it's more so about the rapport and the trust in that patient-physician relationship than it is about all these other little nuances, right? So establishing that care and not waiting until you get sick, right? Not just using the urgent care or the emergency room for your primary care, not using your OBGYN for your primary care. Like, they're there for your cervical health, you know, for your OBGYN, for the specific organ or other specialists for your primary care. But having a primary care doctor, having it established, having a good rapport with them and a good relationship. So that way you can explore the details. Even if they do have those rushed 8-minute visits, you can continue to see them and they can really get to know, you know, what your health looks like, both from the wellness perspective and from the medical perspective through your annual checkups and lab work and all of those things. But, you know, for ladies, getting your pap smear if you're 21 and older, very important. You know, your cervical cancer screening if you're over 50, getting those colonoscopy screenings.
Yes.
If you have other healthcare risks, you know, I could go on and on because I love what I do.
Yes.
But, you know, so having the rapport and having the checkups and just that continuity of care with the same person is really what's going to help you to know if something's off.
Yes.
Yeah.
Thank you so much. And shameless plug, she is also a children's author, so I know a lot of the ladies have children too. So definitely, or nieces and nephews or grandchildren, definitely follow her on NSPIRE Primary Care, as well as Dr. Jade, MD. I want to thank you so much for taking this time and share and being a voice in our community, being a help and being of service. We definitely need you. I know I moved from, I am open-minded and I love everyone that has a heart of service. But when I first moved here, I was very much so interested in, you know, where can I really find a primary care physician or any doctor for that matter that understood me, that even reflected me, that I identify with. And I didn't have the best of luck, but I did for those specific details, but I did find someone that could treat me and that I felt comfortable with and that I established that relationship and rapport with. So I definitely am excited to welcome you and spread the word about what your service offers and just really let the ladies know and gentlemen know, right? Because men's care, healthcare is so important, guys. We want you to be healthy too. We want to be advocates for you as well.
Absolutely.
You know, we'll call the doctor if we see a zit, you know, and so we just want to make it comfortable for everyone. And I just want to thank you again so much for your time. And I'm super excited to introduce and share the service that you have, excuse me, not introduce, but share the service that you have and offer.
Thank you. It's a privilege and an honor. I really appreciate you having me. Thank you guys in the comments. You've been amazing. If you have any other questions, you can always DM me on my Instagram at Dr. Jade MD or at the NSPIRE Primary Care. You can call me Queen is where, or you can call me Books is where our children's books are located. But all of that, my hub is the Dr. Jade MD page. So everything else is connected through there. drjademd.com. You can contact me through there. That comes straight to my email. And the NSPIRE Primary Care website has all the detailed information about the practice, a huge pre-enroll button to pre-enroll. So if you have any questions about anything else, feel free to reach out. I can create content around it, go live about it as well. So I am super excited and just thankful to be able to serve my community in this way. And I'm excited. We open in February.
Yes. Woo-hoo. Yes, super exciting. You guys have a lovely evening. Thank you for tuning in. Make sure you follow Dr. Jade MD, and we will see you guys later. Have a good evening.
Thanks for having me.
Thank you.
Bye.